To this colloquium. Carolyn is a PhD candidate at in the Social Dimensions of Health program at the University of Victoria. So that's an interdisciplinary graduate program here. She's also the editor of Dementia Connections magazine. She's a qualitative researcher. She has many, many years of diverse experiences working with and for older adults and people living with dementia. And I would say her interests really lie in working collaboratively with other people with the goal of fostering equity, inclusion, and social justice for folks living with dementia. Um, and of course, in supporting the development of dementia inclusive communities. And this interest and passion that she has is really apparent in her talk today, which is titled Living with Dementia in Public Spaces. So thank you so much, Carolyn, for being here for this event. I'm really looking forward to your talk, and I'll turn it over to you.
Thank you so much, Mariko. Really appreciate that kind introduction. And I'm going to try to share my screen. And I'm wondering if you can see that okay. It's a PDF version, so it's not perfect, unfortunately. My, uh, is
I
that
think
okay?
I think you just need to full screen,
Okay.
Carolyn.
Yeah. How do I do that?
Perhaps on the left-hand side, you can, there you go. That looks great. Perfect. Thank you.
Okay. Thank you for attending today and for sharing some of your very precious time with me. I know that it's challenging to be on Zoom meetings, and it's a lovely day here in Victoria for sure. So I really do appreciate your willingness to join us and to listen and hopefully have some great conversation at the end. As Mariko mentioned, I've worked in lots of different systems that aim to support and care for people living with dementia. And this has really led to a curiosity about how we can do that. And more specifically, I've come to really rely on people with lived experience to guide my journey and tell me and help me shape how I can help. And so this project that I'm going to share with you today is based on that. And that's sort of the intention with which the work was undertaken. So the project explored how municipal mandates around accessibility and inclusion can support the well-being and independence of people living with dementia by helping them to stay connected to their community and in public spaces. And so the project is related to my doctoral studies, but was also a research partnership between the University of Victoria and the City of Victoria's Office of Equity, Diversity and Inclusion and the University of Victoria. The project was funded by Health Research BC and MITACs and was co-supervised by Dr. Robert Berenger and by Mariko. I was so grateful to have the opportunity to work directly with our partner, Albert Galiev, who's the lead of the Office of Equity, Diversity and Inclusion with the City of Victoria and his team. They're really quite exceptional folks. Oh, that's fast. Okay. So for today, I wanted to talk about the outcomes of the project as well. I'm going to go over that quite quickly. So I've got about 10 minutes of what we did and how we did it. But really what I wanted to dig into today was talking about protecting rights and advancing accessibility using rights-based approaches. And so that's sort of the second part of the agenda today. I wanted to also talk about dementia inclusive innovation that's happening around the world and point you towards our curated collection of resources that were created as a result of this project. And then hopefully to have some time for discussion and questions. And I hope that you come away understanding the project, but more really understanding more of the legal frameworks that protect and support the rights of people living with dementia. Yeah. So, just recently in December 2025, dementia was acknowledged as a major public health priority by the member states of the United Nations. Dementia is projected to become the third leading cause of death worldwide by 2040. Global and local population aging mean that more people are living with dementia today, as age is the greatest risk factor for dementia. Across Canada and Vancouver Island, most people with dementia live at home rather than in long-term care settings. Yet community-based resources to support their well-being and independence are scarce in the Greater Victoria region, as they are all across Canada. Over the course of the project, many people were curious about why we should focus on the inclusion of people living with dementia when there are so many equity-deserving groups in our community. Our project was focused within the city of Victoria, where nearly a quarter of residents are 65 plus, and that share is expected to increase to 30% by 2041, with the most significant increase expected within the 75 plus population. Dementia can occur at any age, but most occurs in older adults, and prevalence of dementia doubles every 5 years for Canadians who are 65 plus. Population aging is similar across the Capital Regional District and actually across BC. Diagnosed rates of dementia are already higher in the Greater Victoria area than in the rest of BC. At the same time, the National Institute on Aging asserts that dementia is underdiagnosed across Canada. Dementia has physical, psychological, social, and economic impacts that affect individuals, families, and communities, making inclusive and equitable provision of supports particularly challenging. Dementia also amplifies multiple intersecting inequities and disproportionately affects women who get the most dementia and also provide the most care of people living with dementia. Dementia remains a highly stigmatized health condition and often results in disabling social isolation for the person living with dementia and for their care partner. The research question guiding our project was, how can municipal mandates foster equitable inclusion of people living with dementia? We explored both the built or physical and social environments. Dementia-inclusive communities have been recognized as having potential to provide a cohesive system of support to enable people living with dementia to sustain well-being, independence, and engagement in everyday life in meaningful ways. However, dementia is rarely recognized or accommodated as a disability in public spaces, and adaptations of spaces, programs, services, and policies are necessary to equitably include people living with dementia in community life. Guided by the city's Accessibility Committee and a 13-member community action group, study activities engaged people living with dementia and care partners who worked alongside city staff and health and social care providers to illuminate local gaps, needs, strengths, and opportunities within the public, physical, and social environments operated by the City of Victoria. Study findings were informed by 24 community conversations, 6 focus groups, 149 survey responses, 21 expert interviews, a data analysis co-design workshop, and 3 collaborative dementia-inclusive environmental assessments. Over the course of our year-long project, we found that dementia is not recognized as a disability by local decision makers, planners, and service organizations. However, the Accessible BC Act and the UN Convention on the Rights of People with Disabilities legally requires legal protection of the rights of people living with dementia for support and to maintain their well-being and independence. Adaptations of both physical and social environments are required to equitably include people living with dementia in community life in Victoria. During the time of data collection, there were no programs, services, policies, or spaces within the geographical boundaries of the city specifically designed to support the well-being and independence of people living with dementia or to promote accessibility or inclusion in community life. Further, no city-affiliated neighborhood house or community centers or social service providers offer community-based, dementia-specific programs or services, such as support groups or recreational programs within the city boundaries. This scarcity is comparable to scarcity of dementia-inclusive programs and services in many municipalities across Canada. Our literature review affirmed that local governments play a key role in the development of dementia-inclusive communities, and collective action across the borders of the Capital Regional District is vital to ensure meaningful inclusion and accessibility in public spaces for people living with dementia. 2 sets of recommendations were co-developed together with project participants and are intended to spark discussions and raise awareness of the rights of people living with dementia. Specific areas for collaborative regional development that participants assert is foundational to challenge stigma and assumptions while promoting well-being, social inclusion, and equity for people living with dementia is the first bucket of recommendations. These include things like forming an advocacy coalition of people with lived experience and their supporters, developing a continuum of dementia-inclusive rehabilitation, recreation, volunteering, and mutual support opportunities, supporting a community of practice to lead coordinated planning and development. The second bucket of actions consider actions that the city might take to make progress towards its accessibility commitment for all citizens living with disabilities, including people living with dementia, within its policies, services, programs, and spaces. These include the integration of dementia-inclusive planning into all community development processes, the review of public service standards to ensure things like emergency response programs are adapted to include people living with dementia and others with neurocognitive differences, opportunities to collaborate to develop a continuum of programs and services or programs to ensure all municipal staff and volunteers have basic dementia awareness training, and in spaces, that there's audits of space, funding, and staff support allocations that take place through an equity lens. You can find the full sets of recommendations in our project report that I'll put up at the end. People living with dementia deserve more than to be locked away from life. The key message from this project is that dementia must be recognized and accommodated as a disability to ensure that the legislated rights of people living with dementia are fully enabled and embedded into community development processes. We were able to develop some interesting knowledge mobilization products from our project outcomes together with city staff. These include an overview pamphlet for distribution at city events to help the public begin to understand what a dementia-inclusive community could look like. We also created a project story map that builds on the city's GIS mapping and incorporates voice recordings of participants to really make voices of lived experience come alive. We also created a 103-page project report detailing our activities, but it also includes lots of direct quotes from participants so that their voices can be heard very loudly rather than summarized and interpreted, and many links to dementia-inclusive innovations from around the world. In terms of next steps, 2 academic papers are planned around the engagement methods specific to involving people living with dementia in community-based research, and detailing an agenda for dementia-inclusive community development across Vancouver Island. I hope that you can see the slides more clearly than they are appearing on my screen. They're sort of cut off on one side. Are they cut off for you as well? Okay, let's see if we can fix
Just
that.
a little bit.
Okay.
I wonder if it's expanded a bit, if
Yeah.
you, yeah.
I'll have a look at that. So I'm just going to break here for a moment and just invite any questions that you might have about the project activities.
Carolyn, while you're waiting for some possible questions, it could be because you increased it to 75% before
Okay.
you did full screen. I wonder if it's just if you were to go down a bit more and then perhaps try full screening and see what happens.
Okay. All right. Let's try present.
Oh,
Yeah.
still doing that.
Still really wants to do that.
Carolyn, if you want to take some questions, I can try and take over the slideshow here if it's not working.
Sure, Matea, thanks. Is there any questions about the project itself or the project activities, how we worked with people living with lived experience, or in particular, I'd love to share a little bit more about the collaborative assessments that we did. Those were really interesting. It's a case study that we've included in the project report. There you go, Matea, that's perfect. Yeah, so just on the right-hand side of the screen is just a snapshot of the story map. The story map is another word for website, but it's created with the GIS technology that allowed us to integrate some different mapping integrations that the city is actually interested in. So you'll see in there, there's lots of quotes, an overview of the project, as well as voice recordings. So the voice recordings we made together with people with lived experience, talking about what they want to see and some of the gaps and needs, service providers, as well as local researchers here that we worked with to hear voices of all of the different stakeholders who are involved. So I invite you to have a look at that website if you get a chance. And if you have any questions or comments or feedback, I'd love to hear it. It's a little bit limited in terms of technology because of the focus on the GIS mapping piece, but it's a great overview. And as I mentioned, you'll find the project report there that includes the case study around the collaborative assessments. So what we did was took a standardized tool around environmental assessment that was created in the UK, and I worked together with a couple with lived experience. So she lives with dementia, and he supports her to be involved in community in many ways. And we worked together with a member of the youth committee for the city. We went to the three community serving organizations that provide programs and services for older adults, and we looked at their built environment through really through the lens of Jean. Jean showed us where the washrooms were. She showed us where the signage was, pointing out gaps and illustrating really the resources and the way that she adapts to different environments. And it was really fascinating to work with her on that standardized assessment. So we'll move forward into the next section and get on to the discussion. Thanks, Matea. So it's almost Accessibility Week in BC. That's coming up at the end, May 31st into June. And so I really wanted to dig down into that piece on accessibility and inclusion through the lens of the Accessible BC Act, as well as some of the other legal protections. So as this slide points out, most people don't want to talk about dementia. And the stigma around dementia, of course, as you all are quite aware, is quite deeply embedded. This has led to barriers to supporting and advancing the rights of people living with dementia. So as noted in the literature review for the project, research evidence underscores how dementia-related disability is compounded by normalized stigma, discrimination, and the social exclusion of people living with dementia. Dementia is one of the most feared health concerns in Canadian society due to fears of cognitive disablement, institutionalization, and death that can be linked to the portrayal of dementia in the media. People living with dementia are considered as somehow less than human, and their human rights are very often violated within our systems of care. Social exclusion of people with dementia is normalized, and reports of significant social isolation for the person diagnosed and often for their care partner are common and were common in our project. Violations of human rights experienced by people with dementia include tangible and intangible harms, such as denial of autonomy, lack of dignity, abuse and neglect, social isolation, restraint, denial of legal rights, financial abuse, and denial of health care. Dementia amplifies systemic inequities and disparities for marginalized people. Dementia amplifies multiple intersecting inequities, increasing risk of experiencing social discrediting and discrimination based on dementia-related stigma that combines with ageism, ableism, racism, transphobia, homophobia, and other social locations of marginalization. People living with dementia are diverse, yet options for care and support are limited in both number and type. During the project, we talked with people diagnosed at age 54 in our local community who are transitioning out of work environments. And we also talked to people diagnosed at 80. These people have very different needs for support and for care. We need to shift our conversation upstream to dismantle the structural causes of inequity for people living with dementia through rights-based approaches. Next slide, please. A network of legal protections, including the Accessible BC Act, provide tools to change disabling norms and improve accessibility and inclusion for people living with dementia and community life. So briefly, this network includes international human rights that protect everyone's rights to freedom, justice, and peace. And the UN Declaration on the Rights of Persons with Disabilities explicitly protects the rights of people with dementia to be treated fairly and equally, not to be discriminated against, to participate in the community, to obtain information relevant to their diagnosis, and to live at home in community among the people who are important to them. As Canadians, we have two basic types of rights. Our constitutional rights outline the basic rules that enable a free and democratic society for everyone. And then our statutory rights enable operationalization of both international and our constitutional rights. They enable us to put these rights into practice. In BC, the Accessible BC Act specifically requires proactive identification and removal of barriers to inclusion and access in public spaces for all people with disabilities, including dementia. Dementia is recognized as a disability by the BC Human Rights Tribunal, who would facilitate a resolution process should a complaint be brought forward. Next slide, please. Throughout the project, when I asked people, what does a dementia inclusive community look like? I was often met with sort of a lack of imagination or a lack of a vision. And I think part of the important work that we can do is help people imagine what a dementia inclusive community can look like and feel like for not just people living with dementia, but for everyone. Importantly, their care partners, but also for other people with neurocognitive differences, people that need to go slower or might require different kinds of supports. It's an opportunity to rethink accessibility. Accessibility shapes daily life for people living with dementia, influencing wayfinding, sensory management, familiarity and comfort, as well as independence, activity, and safety. Accessibility for people with dementia is enhanced when dementia-inclusive design principles are considered alongside universal design principles, and when a continuum of inclusive, adapted, and dementia-specific programs and services are developed. Development of dementia-inclusive communities can also help to increase awareness and understanding of dementia, which helps to decrease the stigma, discrimination, and other social barriers to inclusion people with dementia experience in public spaces. Next slide, please. There are so many ideas we could incorporate into our communities to support the well-being and independence of people living with dementia. Importantly, dementia-inclusive community development also benefits people with other forms of physical and neurocognitive disabilities. In terms of the built environment, we could consider things like that are on the left. So use of contrast to support independence and improved signage to support independent navigation. On the social side, more on the right-hand side of those photos, we could consider things like supporting intergenerational connections, programs, and services. And the top picture there is my environmental assessment crew. We can also consider things like supported rehabilitation and recreation programs that encourage social interaction and engagement with the outdoor world. You can find our curated collection of more than 100 practical resources available to support planning and implementation of dementia-inclusive communities linked to the project report, along with tons of examples of dementia-inclusive innovations from around the world. Next slide, please. Lastly, dementia-inclusive communities have an important role to play in the prevention of dementia. As you're no doubt aware, nearly half of all cases of dementia in Canada are considered attributable to 14 modifiable risk factors across the lifespan. This understanding means that community-based health and wellness risk reduction strategies should prioritize targeting modifiable risk factors throughout the life course to maximize the potential to prevent dementia. This curve illustrates how in early life, less education can modify risk factors. In midlife, addressing things like hearing loss, hypertension, and obesity may reduce risk of dementia. In later life, addressing depression, diabetes, social isolation, and other factors are evidence-informed strategies shown to prevent or delay dementia. Even after a diagnosis of dementia, modifiable risk factors have been shown to significantly delay the progression of symptoms. It is very important that people of all ages understand that they can take action to significantly reduce their risk of dementia, and community-based programs and services have a key role in supporting them to do so. Next slide, please. Prevention also holds important potential to reframe ageist beliefs about dementia. Thank you so much for listening to the presentation about the project findings, as well as some things that I think that we can move forward and take action on in collaboration. If your work overlaps with mine in some way and you're interested in talking about next steps, ways forward, or some form of collaboration, please don't hesitate to reach out anytime. Thank you.
Thank you so much, Carolyn.